Is David coming?
I haven't heard. I wonder if you're coming for the meeting today. Okay. Well, it is 9 o'clock, so we will get started. There he is, right on time.
Hi, how are you guys?
Good morning.
Good morning, how you doing?
All right, that was cute. I took care of it. I'm sure that's just a button, but I didn't even do it.
It's wet out this morning.
All right. Sorry, I'm gonna keep everybody on time today, so we've got some constraints. So I'm gonna call the meeting to order. First on the agenda, view of the agenda. At the request of Dr. Reedy and the county team, what we'll do is, if it's okay with everybody, move the financial report up to just after public comment period. Does that work for everybody? Okay, and then I do have a meeting that I have to leave for at just before 10 o'clock. So Anne will be taking over as vice chair, or taking over the chairman's responsibilities once I'm able to leave. All right, next on the agenda, approval of the September 10th meeting minutes.
So moved.
Second.
All those in favor say aye.
Aye.
Opposed, none. Okay. Thank you. All right, we'll start public comment period. I don't see anybody online that's asking to speak. So we just ask that remarks be limited to 3 minutes for a total of 30 minutes available for this time period. So
Should I go to the podium or?
it's up to you.
Good morning.
Good morning, everyone.
My name is Kathy Skinner and I currently serve as president of the Jefferson County Board of Education. And on behalf of the board, I would just like to take a minute to thank the health department for our partnerships over the years with childhood immunizations and other things that we're dealing with right now. The Jefferson County Board of Education is very grateful for the support of the levy from the voters last November. And as part of that levy, the Jefferson County Board of Education voted to make the health department a beneficiary of the levy. So what I have today is a check for $20,000, which you'll be receiving annually for the next 5 years to help support childhood immunizations. So that's what I'm here for today. Thank you.
Thank you.
Appreciate that.
And should I just leave this with,
Sure.
who wants the money? I give it right to the account.
Right, go to the accountants.
Oh,
All right,
Thank you, Kathy, appreciate that.
Thank you.
Have a good day.
All right, and then seeing nobody else online, we'll go ahead and conclude public comment period today, and move over to the financial report with our new accountants. Clyde and Charlie.
Okay, I see some familiar faces in here. I see some that maybe don't know us. I know there's been some board changes, so I kind of wanted to just introduce us again. And last time I was in here without Charlie and kind of in passing and working on payroll with Wendy and was very informal. So, we are from Consolidated Young. I'm a partner out there. I've been there since 2012. I went to Shepherd University. It was my first job out of college and I haven't left. Okay. I live here in Charlestown and, excited to work with you guys since I'm also a county resident. And I wanted to pass it over to Charlie. She's a manager, and how it works in accounting is managers right below partner.
All right, I'm Charlie Wyoming, and also at Shepherd University. I've been with Consolidated for over a year now. I've had experience auditing government entities and a lot of nonprofit experience. And I live in Martinsburg, so I'm also local. Berkeley County. Yesterday you got a spreadsheet from Gillian. And so one of the things we want to do is import your, oh, yeah, sorry.
Can I
go
talk
ahead.
about some other things?
Oh,
I'm just
absolutely.
gonna introduce.
Oh, okay.
Not to cut you off. I wanted to give an update on what we've done, okay? To kind of lay out, where we are in the process. The first thing we did when we stepped in was we were helping convert payroll over, okay? So in that conversion, we were taking all the data that had been running for payroll in QuickBooks from January 1 to September 10th, and then taking it into a third-party payroll processor. Okay, so our role was basically to be a liaison for this payroll processor and make sure that the transition was smooth. I think so far, how payroll goes is you only hear about the bad stuff. You only hear, hey, my check was wrong. You never get, hey, an email saying, hey, thanks for that direct deposit. It was really accurate. Okay. So we've successfully run the payroll on September 24th, and there was a payroll that paid today on October 8th. So crossing our fingers, we haven't heard anything to where there's been any issues. Everybody's been happy, and from what we've reviewed and seen, it seems to be good. Okay.
Everyone got their checks in their deposits?
I haven't even checked yet.
Okay.
We trust.
Okay.
Yeah, so to give you a little more, background for that, we are not marking up this third-party payroll. Okay, we are billing our agreed-upon rates. And my pay is directly billed every payroll, okay? I wanted to mention that they're gonna do all the quarterly payroll tax returns moving forward, okay? They're going to do all the W-2s come year end. And if we get any tax notices from the period that we started with my pay, which would have been that September 24th payroll to December 31st and forward, they will honor it if it's on their end. So they will pay all penalties, honor that. That's the great thing about having this payroll process. So with all of the things that we've done in payroll, I wanted to move what is the responsibilities of the Board of Health. Okay. PERS, which is your state retirement, is that Compass website, if you're more familiar with that. Our payroll software does not pay that. It'll withhold those deductions and calculate the match. The state has the lockdown website, so it doesn't allow these third parties to integrate in. So we still need somebody in this building logging in and by person saying this was the deductions for the month, this was the match. Right now, Marty's doing that. I'm assuming that she's probably going to be training Gino on how to do that. So it's pretty straightforward. Once you get the payroll report and you just go through it, you just need training on how to get in and how to make it happen. The other one that is semi-payroll related is your health insurance here. It's the PEIA. How that works is the individual employee is 100% covered. Okay, so the only time that it comes to be a payroll deduction is when you add a spouse or dependent or something along those lines. We do not have anybody that has a spouse or a dependent currently. Okay, so there's no payroll function with PEIA. Now there could be in the future. Okay, is all I'm saying. So we need to get Gino up to speed too with that with Marty, because I think she's doing that. So the transition is to Gino. And how that works is you do have to take a 1-hour course online to become a web contributor. But you can fail it as many times as it takes. I think it's a 20-question multiple choice deal. So nothing crazy. Okay. I also want to go over how Wendy fits in. Okay. Wendy right now, she's entering the hours and any new employees. So she's an integral part in this. So she's mainly doing data entry on stuff. We've got her to this point. Anybody new, we can obviously answer questions, but she's gonna be the responsible party. Possible improvements that we could make to the payroll process, just some suggestions. Right now, all these timesheets are being done in these Excel spreadsheets that somebody has developed along the lines. That's where all the PTO balances are. We can keep them in those Excel sheets, or we can try and go with my pay and put it all in my pay. Right now, we don't have any PTO balances on the pay stubs. We can always add those to the bottom. So for now, we're gonna go with the Excel sheets, and as it evolves, if we want to move it over into my pay, we can. I also wanted to mention, we do have a time clock software that integrates with my pay. There's multiple options you can do, and you can roll out this, they can be in unison. We have a hard time clock that can get posted to the wall, that everybody clocks in, clocks out. And then the software can also have a web-based, because I know there's several people in the field or need it on their phone. And it does have the capability to be GPS linked too, if you're like, hey, what job site or where did they start the morning? We only sell that. We don't help you manage it. We just offer it as a service because MyPay does, and they would direct bill you too. Because somebody's got to be the watchdog of this thing. And that's just not our forte or our niche. We just want to let you know it's out there and they got it. Because, say somebody stays clocked in all day. We don't manage up going in and making sure and approving hours, like supervisors will approve the hours, and there's got to be somebody that's at the top of the hierarchy. Maybe it's Gino, maybe it's Gillian. I don't know. You guys can think about how advanced you want to get, with your payroll process. Okay.
What
So-
is the cost of that?
I can look into it for you. I know it's based by employee. That's how all these payroll things do. The more employees you have, the more it costs. It depends. Right now with the contact tracers, it could be in the 20s, but probably full-time people is closer to 15. So there's a lot of these special COVID part-timers that are coming in and coming out.
We don't have a time clock here, do we? We just enter.
No, we just, yeah. So we just sign into that. There's not that many of us. I don't know that would be cost efficient. Yes.
Well, the big cost savings is if you get it right in the time software, it auto imports into payroll. That's the time saver. Whatever Wendy's doing, pulling the time sheets, organizing them, the fact that it integrates and drops it, imports it right in is nice. Now, if the data is bad that you're importing and you're fixing a lot of data and you can't get it right over here to come into here, yeah, then it's more time consuming, to be honest. But sorry, any more questions? I know I'm going on a long time there, just on payroll.
Thank you.
So I'm interesting, you just have like manual paper
Yeah,
cards
we
for
sign
that.
in and we sign out, and some of us do some hours from home sometimes, too, so.
But they're not time saver. Like our software would say, you clock in at this time, this date. The Excel sheet is more honor system and there's no punch in, punch out feel. That's the security that some people like.
And we're small enough that supervisor knows what's going on.
Yeah, I just,
And if someone's out in the field, they know what job they're doing. So it's, and people working from home, you know, what's being done.
And don't you keep track of what grant you might be working on?
yes.
It is also.
So we're logging that, we have to log those hours
Right.
as well. And that would just.
There's certainly
that
room
would be
for
beneficial.
improvement in what we're doing.
I'm giving you, if you want to go full bore with the technology that we have and all the way, not everybody uses this. We only have a select few of people that use this time clock. So we can discuss it. I just want to let you know what advancements we could make. Doesn't mean we have to make them. Considering where we started and where we are today, great improvement. So we were paying, the pay period was ending July 30th, and we were paying a paycheck there, estimating the hours for a couple days. So we've changed that payroll period. We've got everything rolling. I think it's a much more efficient process. Because nobody in-house is preparing any payroll tax returns or paying any taxes. That's the big efficiency right there.
And with that cost, they include all the equipment and maintenance of it too.
Yes, because it's gonna be a different cost. Obviously, the clock is gonna be an upfront cost, whereas if you go with only the browser base, there is no upfront cost. You're just using the software.
I'm sorry, are you talking about the browser that you can download on your phone? The moment you reach the destination, the GPS says you reached, you click, yes, I reached the destination, and then when you leave the destination, you clock out on the app that's on your cell phone.
Yes, you
The
can do.
nursing home, not the nursing homes, the home healthcare agencies use that system. Once the nurse reaches a patient's destination, the parents and the nurse have to sign that I am here at this time, and the GPS tells you exactly what, I use it. And the GPS tells you exactly, but even that, so what I'm saying is that at this point, the people have been working here for more than 10, 15 years, they're trusting employees, even that can be bypassed. You can leave your phone there and you can just go for 8 hours back home, and then the parents sign you, I mean, everything can be bypassed if you don't have trust. So I think that the honor system has worked okay at this place.
I feel like we're hearing from staff, so can you tell us how is it cumbersome to hit a button when you walk in the door that automatically uploads to the software? How is that cumbersome?
I often don't even take my phone with me and when I'm doing the inspection, so I leave it in my car. I don't know, like it's just not an extra thing that I would want to think about when I'm doing my work. So,
Don't we pay, don't we pay for your cell phone?
yeah,
So shouldn't it be with you?
it doesn't have to be with me all the time.
Is it in your car, right?
Yeah.
It should
So
be.
when I'm doing an
It
inspection,
would
like
clock
I
it.
wouldn't expect somebody to think I'm going to answer my phone in the midst of an inspection.
But it's in your car, it's like you're
Yes, it's with me.
Yes, and the
Still
GPS
get the
would know, but
location.
anything can be bypassed. And the trusting that has been shown by this department, I think could continue, because if you're thinking that you were going to use it because you're going to increase the trust that every second was worked at this place, anything
Well,
can
it's
be
not,
bypassed.
I think we're going below the line here. I think it's, it's not a trust thing. It's a uploading and
It's a software.
it's eliminating a person having to sit there and manually put things up. So it's not, I don't think anybody's asking here about a trust thing. I think it's more of an efficiency thing is what I think is sort of what the recommendation is.
I actually see it twofold. I think it's an efficiency thing, which is what Clyde is helping you with. It's continuing to find more efficiencies, and then secondarily, everybody in here right now is acting in a capacity as a public servant. So we have a duty to prove to the best of our abilities that we're always serving the public with the best interest. So I don't see why we would be scared to say, hey, this is what we're really doing. Here's some proof.
It's
How
not,
does
but-
this work with keeping track of the grants? Does the same work that you're doing now not still have to be done?
Yeah.
Because the time has to be allocated for these grants.
That's exactly right.
So if you were doing this as it's one more step than what we're doing now instead of one less. Because what you're doing still has to be done in order to allocate the time that goes to these particular
I
grants.
have to record what hours I'm doing administrative tasks, what hours I'm doing the environmental health work, what hours I'm doing work on the threat prep grant, what hours I'm doing work on the COVID grants, like those all have to be recorded separately.
Right,
every
and
month.
so would Gino, and so would Mason as
Yeah.
well. So, and Dr. Reedy as well. All of
And
you would
Laura
still
as
have
well.
to continue to do what
And
you're
even the
doing.
Sanitarians have to record for
Yeah.
hours every month, so they have to track all.
Yeah, I mean, that's a big part of the work here is allocating that time so it can be built to those grants.
We can always ask them how that fits in. I mean, I'm sure they have a fix on that.
So there's obviously a question there, can any of your hours be coded in a separate manner that separates out your hours based upon what grant it is that you're working on? So you can have an aggregate number of hours, 40 hours in a week. And then within that have those each aggregated and coded separately for the different grants that you may be working under.
Well, it actually might be profitable for the health department.
And it might be more accurate.
But it might create enough efficiency and enough data to say, hey, look, we've always worked on X grant and we can see that the amount of hours it takes to work on X grant is the lost leader, let's quit working on this grant. So
Or
I
it's a
think,
great one.
yeah,
Exactly.
right, so I think more data is important, and we're here to analyze it and try to guide the ship in a way that makes sense. So I don't see any issue with the time clock. I think it probably has to.
Well, we can look at it. They have webinars, they have things that we can sit in on if there's interest in it. I just wanted to mention that we do have it. You know, when you come in, you would just, it has a fingerprint scanner. If you have the hard clock outside, boom, you fingerprint scan, you go in, you come back out, you fingerprint scan, done. I mean, it's relatively easy. We have to figure out this grant thing. So how many people would be working on grants in the building? Is it 3?
All of us.
All of us.
Everybody.
All of us have to
Everybody.
bill hours to the grant.
Even like nurses and
Every single one of
admin?
us.
Okay,
Everybody.
everybody, okay. So, yeah,
Even
We
the
have
front
not-
desk staff.
We've not had this discussion. This is the first, I mean, it's been mentioned in passing, but we've not had a discussion about where we go on the recording of time, many options. And, you know,
Yep.
everything's on the table, but figuring out, is it, as you mentioned, is it an additional step or not? The GPS is interesting, but I'm not sure I need that data unless I have a employee.
I mean, I think you need the data, absolutely. How do you know your environmental fees actually cover the amount of hours that you're in the field? How do you have any clue without concrete data of where you're at and how much time you're spending there? Do you charge like, what, $125 for a septic permit, but what if you're paying somebody $20 an hour to do that, but you really have 10 hours in it? And it costs $200 to process the septic
We
permit.
can't change that fee anyway. It's set by the state.
The septic permit fee?
Yes.
I disagree, because there was a vote a month ago to raise
We
it.
did have to vote, but it's based on the state limits. So
It
when the
was-
state limits went up, we voted to adopt those.
Right.
Okay.
We
can't
just
go
went
above
to the state level.
limit.
Okay, so it's the inverse of that, then we can also say, hey, you know, obviously it's the state limit and the state sets the salary pay, so we're spending too much time on this task, we've got to create some efficiencies in it.
We can't do that. Like, we have to spend the amount of time on a task that needs to be spent on a task regardless of how much we get paid for it. We're public servants, we have to do.
You know,
our
and I won't
basic
disagree
public
with you, because
services.
you could schedule how you do inspections differently, instead of going to Summit Point, go to Shepherdstown and go back to Summit Point for the day. Those are things that are still public servant things that you can work on that data. If you had GPS data, you could say, hey, these routes for the day make no sense. We're wasting an enormous amount of time driving back and forth across the county instead of doing it in a logical manner. There's a lot of things that GPS can do to save businesses money. I mean, that's how Amazon operates. That's why they can beat brick and mortar. That's my opinion.
is it okay if we move to QuickBooks?
Yes.
Sorry if I sparked a little debate
No,
there.
that's okay.
But we will keep revisiting it. Maybe Gino and I here this month will sit down and maybe watch or get some kind of, they'll do a free presentation on how it can fit in your company. They will gladly, you know, see what's going on. And hey, maybe we don't, if we really like it, we still are rolling it out January 1 or this or that. I mean, there's no hard press. I just wanted to everybody know the capabilities that we have and where we can take this thing if we want to. I mean, it is not a forced, you know, takeover here. So, Rate Networks is the QuickBooks processing, I guess not processing, server-based that we use. We do have a user set up for you guys. We kind of pumped the brakes on that because we weren't sure how many people were in QuickBooks. You know, so how many users do we need? And it's a user based on the number of users. So it's $80 or $85 a month. You know, something along those lines. It might be cheaper because you guys have a license with about 5 seats, something like that. So I think it might be closer to 60 once you back out the licensure costs on QuickBooks. But we were like, hey, like, let's figure out what's really going on, because we have a lot of people in QuickBooks apparently, either 5 or 6. You know, if we got 5 seats, I think 5 people probably log in, to be honest. So we were like, all right, do we really need 5 users? Because the problem is with Rate Networks, just because you have 5 seats in QuickBooks, if you only have 1 user of Rate Networks, you're gonna keep bumping each other. Am I making sense there? Okay, so they're different licensures is all.
Is that a typical in an organization, 15 people, you see a third of the people in QuickBooks?
Well, Gino and Gillian, I know are gonna work this month to do some sort of list for the next meeting to say, hey, this is who we know is in QuickBooks and what function they're providing, you know.
What are the credentialing processes? How, we have to develop processes that, where people are credentialed in the standard way.
Are you meaning by like what they can see in QuickBooks, like the
Yeah.
limitations in QuickBooks? I really don't know what's in there. We were looking this week and all it kind of says in QuickBooks without resetting everybody's login is this person has full access or this person has limited.
Mhm.
So until I go in and basically reset their login, I don't know what the limitations on their access
And
is.
establishing the need and the credentials based on the need. So like you said, you not need 5, you need 3, and credential them in, a certain way.
We need to know who's on first. You know, I mean, I think we're still trying to piece that together. And, payroll was mission critical and we got that handled. So now we're just kind of working down the line. But we can also, you guys have a server, or the county does. So we can always get a VPN connection into that server. So it's not terrible. I think our software with Right Networks is a little more dependable and a little quicker and faster. So we can go down either road. If you're like, hey, I don't want to do Right Networks, I'd rather you guys talk to, is it Keith is your IT guy, I want to say?
Michael.
Michael? Okay, Michael.
The county IT.
There you go. So we have to talk with Michael and get set up into where we can do a VPN. And we do that with the client in Berkeley County, at least Charlie does that one. But I want to go ahead and I'm done. I know I'm long-winded. I just had a lot of notes and was trying to cover everything. Charlie's done a lot of work on the budget. So I want to pass it to her to do the budget and we'll just go from there.
So we're working on getting you reports to review monthly. And a big part of that was taking the budget you approved and putting it into QuickBooks. The initial one Tuesday, I met with Dr. Rudy and Gino. And we went over a budget allocation because what I had was just personnel expenses and operating expenses. And so I needed to come up with a way to allocate that so you could see it in QuickBooks. Yesterday, we found some additional information that broke out the expenditures a little bit better. So I revised those calculations. That's what you have. So what I need from you guys is I need you to review it, see if it looks reasonable to you, make sure it is the budget you approved, and then we can import it, or I can key it into QuickBooks. And then you can have a good budget to actual every month.
I know Mr. Lutman especially had like where you saw current expenses, 258,000, right, on this budget that we were provided. So what we were trying to do was say, how does that 258,000 get allocated across individual line items? Because it was pretty difficult to read, because you're like, well, what's in it? How could we cut? What could we cut if we're at a deficit? So that's what we were trying to do, is be more transparent, to show you. Thank you, Kyle.
We do this all the time. Gotta look at line item by line item, find it.
And
Curious, so in the workbook that I received
yes,
prior to the meeting, there were 2 worksheets.
yes.
One was from 10.5 and one was from 10.7. What's the difference?
Yes, so the 110.7 is the most up-to-date allocation or budget. And based on, so the original budget I received is the operating expenses $258,000. So I just put that $258,000 and on a percentage allocation of line items from last year, allocated expenses. But there was some additional work papers that said, okay, well, environmental expenditures are supposed to be $25,000. So then I had to go back through and make sure that those allocations were correct. So that's the most up-to-date one, 10/7 updated numbers.
Thank you.
So the budget numbers that you have in here, does that come from the actual document that was approved by the board?
So,
Like
yeah,
the,
so I do have a question on the salaries or the personnel expenses.
Mhm.
Because the one that's currently entered in QuickBooks is $20,000 lower than the document I received yesterday.
Could be the OT is like
No.
25, right? Or
And that includes the 25.
well, could it be because of unfilled positions?
Possibly, I'm not sure. I have to see the documents that she received.
Yeah.
I have not seen that.
Yeah, and I'll send this to you. I do have them.
And then I can show you the one that was actually approved.
So what's in the budget actual that you have today is the allocated budget from 10 pot. So the original one that I had done. But I don't want to update it until you guys have had a chance to review the updated allocation to make sure that, you know, it looks good. This is your report. It's giving you the information you need.
So what Gina pointed out for this meeting is the 10-5.
I think I actually printed out the 10/7.
It's 10/7.
Oh, it is, okay.
Yeah.
Okay.
I mean, I think we might be in a situation like we were last month where we maybe don't have everything in front of us to sort of make decisions.
That's fine.
I think the question would be for us to get a copy sent to us of what was the actual proof, 'cause not everybody was here.
Yeah, that's a
That was done.
good point, too.
So I don't want to make any decisions. I don't
Right.
think
I'm
some of
ready.
us.
Yeah.
And there's two items that, I think we're correcting that were actually incorrect in the budget, such as my salary. A year ago, I was a contractor from Berkeley Health.
Mhm.
Now I'm an employee. So they're just little things that it's in the wrong spot. The money's no different,
Right.
but it shifts things around so that it's more accurate. It does reflect where things actually belong. So it's, a lot of it's cleaning up, you know, and saying, should this overhead be charged to this department or that department? And is it consistent with our, so it's, we're trying to make it a real document. As each month goes on, we say, yeah, this is accurate. I don't think that we have was as good as it should be.
What about the revenue set? The revenue set seems to be way off. From what Cox Holiday prepared. You think this is any remotely accurate? If the revenues were this far off?
So are you talking about your actual numbers for fiscal year 22?
No, I'm talking about what was budgeted in Q3. Or what happened in Q3 versus the budget?
So overall, we're at total income of 23.5% of your budget. We're 25% of the way.
So
through the
this
year.
budget was for the whole year, not.
It's where you're at.
Okay, all right.
Yeah.
I wanted that clarity to make sure that
Okay.
In
wasn't,
the state
Yeah.
fiscal.
that you had it
year
done on
begins
a true base. I want to make sure they didn't take the
Well,
whole year budget.
what we do, Dave, what we do
It's
is we enter the whole budget in, and then you are able to see and say, well, payroll is 100,000. We paid 25,000 so far. We still have 75,000 in that budget.
Mhm.
So it's not by month. We drop the whole thing in there, and that way you know.
That's
You're
the
working
clarity.
against.
That's the clarity I want to
Oh,
look at,
okay.
that you weren't, that you didn't take the budget and chop it into quarters or.
Yeah.
anything.
The whole thing is sitting there in that one budget column, and then that way you know how much you utilize and how much you have. left.
25% is the number we're looking for.
Yeah.
This number is very
And
close
so
to that
for
budget
your-
that we approved back in May at 100.
So-
I think it's
For your
124
total
or something.
income,
140
you're at
Yeah.
25 or
We're
23.5%.
looking
Total expenditures, you're at 24.3% of your budget. So you're on target with what you budgeted.
And income is the hardest number. We've talked to Dr. Reed about this. You don't know what you're gonna collect on immunization. You don't know when you're gonna get the grants. There's a lot of uncertainty. There's some things that you can say, yeah, this is kind of certain. And we can tweak it, you know, with having the good numbers and all in one report. As you see fit, we'll make changes. You know, you tell us what you want it to be. These are not my reports or Charlie's reports.
Mhm.
They're yours.
So question for you then, so right now, it's showing that we're off. on our budget. Is that correct? Like, we're tracking to be in a deficit.
Yes,
Okay.
That's what the plan signed budget was.
Okay.
Was to lose 6 figures.
So this was, okay, so this was the one that we had talked about. I think
Yes.
you had talked, okay, all right.
And our goal is to not have a deficit.
Correct.
But we're not
Not there
guaranteed
yet.
that. It's a,
I think that's Gina's big
Well, that's,
big task.
that comes down to
sorting
multiple,
that out.
multiple things, and that includes correctly billing medical insurances, especially CMS, things like that, and doing it properly and making sure that it's done on a regular basis.
Right.
And not skimping on those types of things, not giving anybody who has private insurance and, an off on that and saying, oh, this is too difficult to bill and blah, blah, blah. We have to make sure we get paid.
and if we are allowed to bill
It's in the
$120,000,
You fix the revenue.
to be sure the hours of staff are allocated each week, so that each day, so that they're there to justify it. when they audit it.
Correct.
So all those little discipline things that we'll be tracking it in with them.
And that's.
You sure you really want to work with CMS?
I've done it for years.
Oh, really?
Yeah.
Oh, wow. I need to get to know you better.
So then
I think
questions
you have it on
like
your resume.
the check that we just received from the Board of Education, did we know that was coming? Was that in this budget? Or
We
was-
have received, and I think it's in there somewhere, we have received money from the board, but I guess they just allocated it for 5 years, so that's nice to know. And then there are other opportunities to get money, but it would probably be more of health services that we're helping supervise, that we get money for the staff members, but it's almost a wash. But still services.
So the only thing, that this budget doesn't give you is what's on the balance sheet, right? That's a profit and loss, so it's not giving you cash balances. So we can also incorporate that, think about that, what you want to do if you want to, track that throughout the fiscal year and kind of see cash. I mean, I think that's a good number too, so I also wanted to speak on timing of everything. Okay, so we got the bank statement this week. So how we get the bank statement, right? We're an entity that's reported on the county commission's audit. We're a line item on the county commission's audit. The bank statement is coming from the county commission. We do not have a login. They will not give it to us. They're sending us this bank statement. So we got it, third, fourth, whatever. I don't know what day, when we got it exactly. We attempted to reconcile the bank this week, but we have questions, and that's not unusual, okay? All I'm saying is, if today was a normal board meeting where we're on the 7th, maybe we expect to look at data that's 45 days old. Or 37 in today's instance, because to close everything down in 6 days is a little difficult, and to get your reports. So we got to figure out the timing of things, because Charlie looked through everything and then has, like how many questions you have, just, not big things, but small.
yeah, towards the end of the month, we saw some deposits that have not been recorded, but out of 48 deposits, $72,000, I only saw unrecorded deposits of $6,500. And then out of $103,000 of checks and charges, $300 wasn't recorded. So I think what you have is materially correct.
It's close.
Yeah, it's close. Like, it's gonna change your revenue percentage 0.7%, something like that. So I have already talked to Wendy, and we're gonna work on finishing the reconciliation.
So the question becomes, do you want to see these rough numbers, if they're close enough like that? Or do you want to, hey, I want to see final reconciliation done, closed out?
Which means you want to come to another meeting, you want to have more time, is that what you said, you would get those final numbers next month meeting, is that what you mean?
Or would we look at August this month? Through
Okay.
August?
Yeah.
Because we to close September, we've only had, 6 days. Well, not even with the weekend, we've had really like 4 or 5 days.
Right.
And we got the statement, 3 days ago. So Wendy hasn't had enough time to even answer our questions.
That begs the question, should we have our monthly meeting later in the month?
Same
To
question
let
as
them
about-
get What's that?
I think it's in the bylaws.
Yeah.
Do we have that?
Yeah, it's in
written
our bylaws.
So we have to change the bylaws.
Right, which can be done. If you-
Well, but I mean, why not just have the 30-day delay? So end of August. I mean,
I
It's up
think,
to you.
I think
It's
we've
hard to
always had
manage
a
on a
30-day delay, because
Yeah.
this has always been an issue with getting
yeah,
everything done.
I just, there's, I mean,
How do you run a company?
And this month's a classic example with
everybody
the,
knows with their bank
with the way the
statements.
month came into, with it being the
Not
second
calculating
Friday.
down to the last cent every day.
Oh,
Yeah, you've had
Yeah.
problems for a while with, oh, you get it at 10 o'clock at night. That's
Right.
not adequate time
Yeah.
to look at it and ask questions of us, so.
So we can also look at 1 month delay. And is it very difficult to give us like a rough of the immediate month behind us? So that we can compare, okay, so it's close enough, so we can move. on
Yeah, I can
with our
probably do what I
business.
did like this month, let you know,
Right.
what I've noticed isn't recorded, so if there's a big variance,
We can approve the budget a month late, but then we take a look at the closest one, just. to
That's a
make
good
sure.
idea.
Yeah.
I think I am done.
I don't
Do you-
have
do you have
anything
anything
else.
else? Is there any questions that are still remaining?
I think there's the one takeaway is to look more into the GPS time clock thing
Does anybody
software.
else- You don't know my feelings. Anybody else have any feelings?
I think it's worthwhile just taking a look at and seeing.
Gino and I will schedule some time.
Yeah,
We'll
I
take a look.
just,
Can you bring us a proposal for next month's meeting?
Sure.
Is that possible? Do we need to make a motion for that, Karen?
I have a proposal.
Good.
I don't have any, I don't want to prolong this, but
No.
at some point, it'd be nice to get clarifications as to what the county's jurisdiction and authority is in the states in terms of who's employed by whom, when you say the bank statement comes from the county commission. So obviously the bank account is held by the county commission, and yet most of the funding comes from the state. So I'd like to get a feel or a handle, some sort of clarification, so I can get my head around it as to how it all
Where's-
breaks out versus state versus local.
well, according to the state, the county has a responsibility to be compliant with the state regulations. And so it is a kind of weird dichotomy because the counties, so if all these people went away, but we still had to do different services or whatever, and the state had to come in to do those services, then the county would get charged for that.
But the funding comes from the state.
It comes from multiple. We have federal, we have state, we have
I
private,
mean,
we
some
have
of the
revenue.
funding, yeah, comes from the state.
So we have
I'd like to-
multiple sources.
And in the past, here and most jurisdictions, the local funding was much larger than it is now,
Mhm.
as was the state funding. And so it's,
So there's more and more federal funding and other sources
Well,
besides
the
the,
federal gets passed, we don't get federal directly, it goes through the state and then to us.
right? So that sort of becomes state funds, because that's the direct source.
Well, it's state grants, so it's all THR grants.
But it's not collected from state revenue, so it's not state taxpayers' money going to this, it's federal, it's coming down from the feds.
But the state has special revenue accounts that money flows through.
Right, but it's not generated in state, is what
No,
I'm
I
saying.
understand that, yeah.
we get a specific amount. We can have a presentation. next
Yeah.
time,
Let's do that.
Yeah, that would
comes
be,
from,
that would be helpful.
Thank
and
you.
importantly, how stable it is.
All right, thank you.
Thank you
very
so
much.
much.
Thank you for having us.
Thank you, guys.
See you next month. So, just so I get my timing right, is it the second Friday or is it the first Friday?
Second.
Second, okay, because I didn't know if the first counted at the phone or if the.
It's always the second.
Yeah, just making sure it's the first.
So this is the earliest.
Yeah, this is the earliest, so we would have the data better. I'm just trying to
Yeah.
walk it out in my mind, so.
I'm
Sorry.
not gonna budge you out.
November 12th.
November 12th, I will get it on the calendar. Thank you, Dr. Reed. Hope everybody has a great weekend.
Thanks.
Thank you.
Right, right.
So Karen, I think we skipped over the minutes.
Oh, shoot, yeah, sorry about that. No, I thought we did.
No,
we
we
did
did.
those. Yeah, I checked it.
Very quick.
I was like, I had it checked off.
Yeah, that's cool. No, we definitely did. I made a motion.
Less than a minute.
All right, we're gonna move over to unfinished business, but before we get into update on vacancies, would love to have an introduction to Gino.
Hi.
Hi.
My name is Gino Cisco. I have a bachelor's degree undergrad from Shepherd University. I have a master's degree in public policy with a specific concentration in health policy from American University in Washington, DC. Fun stuff, I graduated with honors from both schools. I was a Marine for almost 6 years, 4 years of active duty, year and a half of active reserves, where I would build bombs. So that was kind of fun. I've been a resident of the county since even before I went into the Marine Corps. So since 1990, I've been a resident. I bought a house in Harpers Ferry where I've lived since 1997. I have 16 years of managing medical and ophthalmological offices, optometry offices. I was a certified optician before I went back to college. And so a lot of this stuff I've done a lot of work, medical billing. I've done a lot of work managing healthcare offices, all private. And then after I graduated from graduate school, I did some time doing as a due diligence officer for Goldman Sachs, a company called Exeter Diligence. And after that, I went to the Charles Koch Network. I worked at Charles Koch Foundation, Charles Koch Institute, and then at the new version, the all-encompassing Charles Koch Network, which was called Stand Together. And I worked at Stand Together as a data analytics, social media data analytics analyst. And then I saw this opening, and I saw the opportunity to give back to my community, which I love. And this is definitely in my wheelhouse from my experience, my education. So I think it's a nice little fit. So.
Welcome, we're glad to have you here.
Thank you.
And these two are great.
Did you know Dr. Reedy before?
I did not. I should have. I wish I had known him earlier.
All right.
Work together.
Yep.
We met Laura last time.
Yes, so yeah. Welcome, both of you. Thank you. All right, on to the vacancies, and I'm gonna step out in a couple of minutes, so.
So I did just offer one of the front desk positions to someone who should be starting in about 2 weeks. So the other front desk position is still a vacant. And there's a reason for that. One of our staff is trying to transition into that position. So I think we're still trying to figure out how and if we're going to be able to do that. So.
And then with the state conversation, so in the email discussion, you and I reviewed back and forth, you and I've had, so are we sort of good with the state in terms of the changes to the pay scales that we asked for? Or sort of?
We are, that's on, it's a line item on here to discuss. So
Oh, okay.
It's the next item if you want to move into that. So
Unless anybody has any questions on vacancies.
that's the only vacancy we have left. is
Okay, good.
One office assistant. So yeah, I sent everybody the most recent proposal. I worked with the DOP to revise it because they said they couldn't do anything with the top end of our salary. So the only thing that I could ask for was higher starting salaries and retention incentives. And this is the way they worded. They call them special hiring rates and retention incentives. So this is the latest proposal, and I asked for increases of most of the positions. Sanitarians, I didn't have to, those are already pretty high, and yeah. So, do you have any questions? about
So did this get considered at the last meeting in
It's-
September?
it? No, it's going to be considered in this meeting in October, so it's
Okay.
later this month.
Okay.
Yeah, they've been working on a lot of things for our office, and we worked on a couple of other things for me last month. So this one got pushed off to the October meeting.
You talked about they work with you in certain ways, like retention. Is that meaning they're working with us, that they'll fund some of that, or that's just how they look at it?
No.
Okay.
Yeah, just we have to get approvals from them. They don't provide us extra funding for any of.
Well, I was
this.
kind of hoping that the way you were talking, that's what it was. But so that means we still have at some point in the future, a county commission piece we have to look at, or at least consider.
I mean, possibly, I think Nathan went over some of the drawbacks of that the last time we discussed it. Because we are classified employees have to be offered certain protections.
No, I didn't mean the county commission, sorry, I mean, the funding piece for the county commission at some
You're
point.
definitely going to look at.
Yeah, I'm gonna make it too complicated, but at some point, you know, and their budget comes out in March
Mhm.
for the next year.
Right.
So you guys at some point should think about what you want and who's gonna do the lobbying.
Way ahead of you.
Right, yeah.
So what is the status of the American Rescue Plan dollars?
They were supposed to be debating that this month, in terms of their allocations and whatnot. So I'm not sure. I haven't talked to them in a couple of weeks.
And I haven't been able to attend the meetings and I haven't heard anything.
Yeah, they pushed it off. They were originally dealing with it this summer and then they pushed it off into October. So I don't know if that's been continued or not.
Is the board looking at this, other states like DC, Virginia, their salary, like on
Oh, yeah.
comparison? So I don't want to be mean, but Washington DC, just my increase in salary was $15 an hour.
Mhm.
Increase in pay
Mhm.
per hour. It's really, I mean, it's really, you know what I mean? So not you per se, but the board itself, does it actually look at California giving a nurse $125 an hour? I know. So if they hope, maybe they can do some sort of comparison.
Yeah, unfortunately, we're very close to DC, but we're still in West Virginia and now
Yeah,
median
the state
income
sets our
is
salary.
49,000 per household.
I'm just hoping that maybe you can take it back to them. Hey,
Oh,
Well, this is actually,
Yeah,
this is what Gillian's been
yeah,
working
that
on.
is exactly what I've been working on, is getting higher starting salaries and possibility for going above. They did tell me there was a possibility for going above the high end if we end up hiring somebody who has a lot of qualified experience and puts them near the top of that range, and also the retention incentive. They would, as long as it was previously approved, allow us to go above the top. But the tops are low in West Virginia, the top salaries, so there's really not a whole lot we can do about that. We live in West Virginia. so.
I just didn't know who's going and taking this to the board.
Well.
She has,
We've been-
yeah, the state decides
The
it. It's
state
not us.
decides. So it can change, but the state has to do it.
I wish we have a way to reward employee per merit, you know, if we, you know, per review and they do a very good job, we can say, we can award you extra money that, you know, that offset the salary the state allowed, but I don't know if we can. work
Well,
with
a couple of things. Number one is that's the work that Gillian's been doing. Even with the American Rescue Plan money that gave bonuses to people that were here, that were working during the pandemic, we had to go to the state to get approval to be able to give that to the employees that were eligible for that. So just to give you some context, but also there's been work I know I've been in conversations with legislators who are interested in trying to help us with that, but we have to know what we're asking for before we go and make that ask. And so that's the stuff that Gillian and I've been working on, and look forward to working with Gino on that, because we have to go with what we need, or actual data versus just saying it's too low.
And we also have to make sure that we can pay these salaries.
And we certainly, I'll speak for myself, we certainly understand it. This is not per se a new problem here in this region. We're in the most affluent county of the state. And we understand the competition's not far away. And budgets and approvals are set based on the entirety of the state, just not this county. So last meeting, we discussed like how school teachers are handled, where they get stipend through the board of ed above the rest of the state's salary range for school teachers. So we understand that you're looking for reasonable solutions. It's an
And there
ongoing
is-
problem. Yes.
There is another grant that the state has given us an opportunity to apply for, and this grant will allow for retention incentives that we can pay current employees that have been working through COVID. So it has to be COVID for kind of like what the county commission did, but they're calling it something different. Where you would be able to request these bonuses for our staff.
Do they offer any funding for that? With the, it's a grant that
It
would
is a
offer,
grant.
that would offer the funding.
I
So it either
support- I
covers
support
that or it
it.
covers the employees, so I think we'd rather spend money on our staff.
I'm so sorry, I understood it wrong. I thought that you guys were taking the information from this meeting to the state. That's. I'm
It's
sorry.
already been, it's
Yeah.
already been sent. to
So that's why I
the
made a
state
mistake. I'm sorry.
Gillian's already arm wrestling with that one. I've seen the emails.
No, I apologize. I apologize for the misunderstanding.
No, that's fine.
No, it's okay.
You need to understand it because you one of the supervisors here. So.
Yep.
So can we move into the next item?
So the grants update, the state grant department is extremely short-staffed right now, and we are still waiting on final approvals on pretty much all of our grants that we submitted for this fiscal year. So I don't have a final approval on the really large ELC two grant yet.
Is that the 137?
That's higher than that. The 137 was the first ELC grant. I don't even think the ELC two funding, well, I think it has that accounted for somewhere in our budget, but that one's even larger. I want to say it's 545.
It's based over several years.
It's based through 20, maybe 20. I have to look again. It's been a while since I looked at the whole thing, but we're still waiting on final approvals for that. Final approval on our immunization grant. I have this new grant to apply for, and I'm not sure the exact funding amount of that grant. But that one's due today, so. It's actually due next week, but it's due today to the regional person because we applied for that one. And I think we have our TP grant, that's the one that has been approved.
What is that one?
The threat grant, so that one has been approved, but I think everything else, we are still waiting on the final approvals for, unless Dr. Reed saw anything on one of these immunizations.
I don't know. And it's not just us, it's all of the counties.
Yeah, it's the state, their grants office. We also don't have a center for local health right now because I guess the one person that runs the center for local health retired. So apparently the center is just one person.
Oh, wow.
So the personnel issues are also at the state level, and they're not unique to Department of Public Health either, but throughout public health, it's throughout the state.
It seems like nationwide, everybody's short of something.
Yeah, and the state is I guess they're using some of their grant funding to try and build the center for local health. Is where it is more than one person.
Thank you both. The staffing issue is really improved. I appreciate that. Both of
So do we.
you guys were most of the game, weren't you?
Yes. So I can't tell you how happy I am to have an administrator on board.
I'm
So
sure Marty will be happy too. She can have more time at home. So we move into new businesses. We did the cost holiday, and then we can get to the Attorney General letter from both the county prosecutor discussion. Who want to discuss that, Reed?
Would you like to?
Well, I guess it depends how we want to do it. If you want to just talk about the letter a little bit, I can do that. If you think you're going to have like Jefferson County specific questions, then maybe put me to the end. So we don't have to go into executive session and come out of executive session, so however you want to. But usually, sometimes it seems easier just put me at the end so you don't have to worry about, I don't know if we have anybody online or not. I don't know.
There's
but-
a couple people.
Okay, so then logistically, it might be just easier to wait to the end in case you have,
Why would it require
I don't know, I don't know what questions you're gonna have.
executives? Well,
Yeah, so
the letter simply says that with regard to things like mask mandates, right? That's what we're talking about. Everything starts with the governor. After that, the Board of Health has jurisdiction, but final say is from the county commission. So the Board of Health you know, except for the Board of Ed, which is a state. Which is state, but it's the governor, that's the hierarchy, the governor, the agency, and then the county commission.
Yeah, I think it's a pretty well-written letter because it's,
Pretty clear.
as far as for legal letters go, because it just answers the minimum question that has to be required, but it doesn't go to like $64,000 question, you know, but doesn't have to, that's an efficient way to do these kind of things, because the question was, is this letter effective? And they said, no. So basically, I mean, you know, that's the bottom line on it, but it didn't really go to, there's a lot of other unanswered questions there that,
Is
you
the
know,
letter effective?
it was the letter, was a letter from to the school boards enforceable, and they said it's not.
To the school board?
Right. But they didn't go, I mean, it was very well written because they didn't get too far into the weeds, I think, that's it.
Right, that's very clear.
Yeah, and I think we were
Not
already,
notwithstanding,
Right.
it's very clear.
we were already aware of what our authority was. So we knew after the Senate bill passed with the county commission that any rules that we promulgate have to be approved by the county commission now. And we also know that the only time the health officer had extra authority that would be outside the Board of Health was when the governor gave him that in an executive order.
Well, let me just clarify that. Any order that we would issue doesn't have to be approved by the county commission. The county commission would need to take an action to rescind it or to prohibit it.
Any rules that we promulgate do have to be approved by the county commission. That went, it was the Senate bill that passed earlier this year. It's
It
gonna
went
affect
into effect
now.
in the spring. was
So
new.
any rules, if we go to change anything in our existing rules, that they can't do anything with the rest of the rule, but the part that we're trying to change, they have to vote on and they have to approve it.
Are you talking about internal rules or public policy?
So it's
It's
the rules that
both.
we promulgate.
It's both.
Okay. You say so.
Do we have any more question on the letter? It's clear.
I appreciate the guidance I got from our council. It's guided me in the right direction. The Attorney General's letter was exactly what we were talking about. So there were no surprises.
I mean,
It's very helpful.
looking at it, I think the question that they didn't get to was, can the Board of Health tell the school board what to do? That, you know, I assume that was the underlying question, but this letter doesn't get to that, and it avoids that by being technically correct as far as what, you know, the process was.
As far as the mask mandates go, all school boards were directed by West Virginia Department of Education to consult with their local health departments to come up with their own local policies. So ours did consult with us, Dr. Reed made recommendations, and then they made final decisions.
Right. And it
And
looks
that's the way it's supposed to work.
where it looks like, but they didn't get to that, but yeah, that's what, it was
Except
slightly
that
different
we
approach.
clarified in our resolution that Dr. Reedy was not speaking on behalf of this board.
I understand that.
There was some confusion from a couple of members of the Board of Education before. So
Can we move on?
Okay, we're gonna move on to update on COVID-19 activity and vaccine.
So in the past week, the number of daily and weekly cases has decreased. We were seeing about at the peak, we had 300 new cases a week in Jefferson County. We're down to about 200. Yesterday, we saw 40 new cases, which would bring us back up towards the peak. So what we are anxiously watching is whether this decrease in cases is what some people call plummeting, or if that's an overstatement. To me, plummet is depending on how sustained is the decrease. In India, it did plummet, and they went down extremely low after their surge with the Delta. In the United Kingdom, it decreased, but it stayed at a significant level. don't know. No, nobody knows. We can say, well, in the past, and it's going down all the way. We don't know what the new normal is. We also don't know how many future cases, as more and more people have, from one reason or the other, have some immunity to this virus, how much that immunity will protect them from future exposures, either from the identical variant or another. We don't know that. We didn't know it a year and a half ago. We have better understanding that there is some protection. There were fewer deaths this go round than there were last winter. Many more cases in young people, so under 20 was up to 35% of cases so far. Last 15%. So we're seeing it in young people more frequently. Fortunately, the young people under 50 are quite unlikely to be hospitalized or die. But they still can get sick, and they still can have some long-term side effects from it. So we're hoping the numbers continue to go down, simplifies things, but can't know for sure. For a budget standpoint, we could hire people to help you with case investigation, tracing. But it also takes considerable amount of our time. Supervising.
So we were gathering that comparative the last meeting we discussed about possibly comparing the negative part of COVID's all negative, but the hospitalization rate and the death rate to the dengue and flu, so we can kind of have maybe convey to the public, hey, this is way worse than flu, or it's right at it right now.
Way worse. The information I saw yesterday's Steve Allen, which is a management hospital, we had, I think, close to about 45 cases in the hospital with COVID. And, between two hospitals, so that's a significant number of cases. That's more than we would see in the usual. The deaths have not been as many. There still are, and we expect, even if the number of cases goes down, dramatically more people who've been infected, they don't die in the first day or two. They get sicker as time goes on. It's not recovered. So at what point this will become biologically more like the flu probably has a lot to do with how much immunity the population gets. How long lasting immunity is for each individual in each different category. So an 80-year-old's immunity to influenza, an 8-year-old, an 18-year-old, they're very different, and they're different with different strains of flu. So we can get general ideas and make some predictions. We hear those a different prediction every night, I'm sure, on the news. But we have to look and see what's really happening, how protective the vaccine is or infection is. We don't really know that. 3 months ago, we said the cases are very uncommon if you're vaccinated. But at that point, we were seeing very few cases. Now, half of our population vaccinated. We're seeing fewer cases of the vaccinated group. Certainly not zero, fewer deaths in the vaccinated group. Zero. Most of the cases are still occurring in the elderly. When we get the more likely, someone who's over 75 who gets COVID still could have chance of dying. So some younger, it's under 1%. So the overall numbers really can mislead you. So if you're playing Russian roulette with 6 bullets, and you only hit 1 bullet, 6 chambers, that's about a 16.6% chance of dying. So 15% is, it's dangerous if you get COVID. Now you may have no symptoms at all. You may not be aware of it, certainly soon. We have seen cases in the nursing homes, and many of them have no symptoms of it. Start testing everybody. But we have also had people vaccinated and non-vaccinated. Some of them are quite elderly and frail, and COVID existed, but they probably would not have lived much longer without it. So we have to be careful attributing everything to the pain. Not each person in the hospital is sick from COVID. They may be in the hospital for another reason. They get tested and found they have COVID. It's clearly something different. But that's a minority. Most of the people in the hospital with COVID are there because of COVID. So
You had mentioned that the cases in India plummeted.
they did, they increased.
So-
Now, how much, and even our local data,
Are you aware, though, that it plummeted after India started using ivermectin as a treatment?
so one of the problems with local data, state data, national data, and international data is how valid all the information is. It's
Always, garbage in,
It's really
garbage
hard
out.
to know, and a problem that we deal with and we need to remedy for future, local, state, and national, is, we can't do much about international, but is having good information systems. Most of the computer software that we're using, we were not using. Some of it didn't even exist a year and a half ago. So it's not like what Amazon has, United Airlines, where they've been doing this for 20 years. These are some programs that there's some big holes. Not to have distrust of the data as a whole, but to be real careful when you're starting to compare small differences in numbers, because they may not be real.
And that's
We just saw that with the CDC overcounting some vaccinations.
So what is the status of the people signing up for the booster shots, and how busy are you, and are you in need of volunteers?
So we will need some volunteers, but it's not what we're expecting. It may be like last year, that we would suddenly have 1,000 people calling each day. But the calls have been trickling in, and so we're maybe giving 15 to 20 third doses a day. We are able to give everyone the doses when they the same week. I think that's appropriate. This is not like the first doses we were going from no immunity to have some protection. We're in just as bad a time as far as the lots of cases. We're just as bad as we were last January. Another piece is that by luck of the draw, we mostly had Moderna distributed to us. Moderna's immune benefit seems to be a bit longer, so they have not yet requested booster dose. They probably will. Probably will be a lesser dose than they had before. So those who had Moderna who want another dose now, it's not recommended because there's no clear benefit from getting it. There's a good theory of why it might work. Even with Pfizer, all the experts say it's not going to change where we are right now. But months from now, those people may. So I got my third dose, not the first day it was out. I did
Well, didn't the FDA decline to recommend boosters for the Pfizer shot after, for people under 65, after hearing testimony from doctors?
They only declined to advise it for the 18 to 64 age group that work in a high-risk occupational setting. They did go ahead and approve it for the 18 to 64 that have underlying conditions, specific underlying conditions. So they did recommend that. They didn't recommend the occupational setting. That got overruled by the head of the.
That was overruled by what?
Basically, it was the head of was it the CDC, yes, that went ahead and even though, I guess it was the CDC that didn't recommend it, or it wasn't the FDA. It was
The
just that
FDA
one
agreed.
category,
The FDA declined to recommend the booster
just the
shot.
one category.
So the FDA has an advisory board, and then they've got
Oh, I know.
the full thing, and
I
the
know people.
CDC the same way. And they both need to, so there are different levels of authorizing. One is sort of advancing approval, which. So some aspects of the Pfizer and the Johnson & Johnson are authorized, which doesn't meet the level of data that's required for approval of the regular drug market. And so the Pfizer is approved now for those over 18 to get 2 doses as of the end of August, to get 2 doses. Under 18,
It's still an emergency.
this is still emergency use authorization.
Right. It's not approved.
But it's legal for us to give. It's not considered for practice. Sufficient evidence to show that because of the public health emergency, this is not simply leg cramps that existed for eons. This is a new thing. It's got higher mortality than on the whole programs. Decided that it would be appropriate to allow the use of this. So I'm not pushing people to get a 3rd dose in any of those categories. It's certainly available. People who are calling and wanting 3rd dose of Moderna, 2 doses of Pfizer, they got Johnson & Johnson. I am not authorized to administer that. My agreement with CDC, the FDA to receive these vaccines to distribute these.
You keep talking softer and softer.
I'm sorry.
So we don't have the 3rd booster, the 3rd shot for the Pfizer as of now.
We have it.
We do.
We've been giving it out.
Okay.
Yes,
So,
it's the day it was, the hour it was.
There is a difference though. Dr. Reedy is saying 3rd doses, but what he's actually speaking about is a booster dose because 3rd doses are a different category that they were approved for both Moderna and Pfizer, but you have to have very specific underlying conditions, like immunological.
So the Pfizer you're giving now is not the same like volume as the first
It is.
shot.
It
So
is.
it's identical. I mean, it's
Yes.
identical material, but I mean, you give the same amount. You don't give like a lesser amount for the 3rd.
No.
So okay, so it's just like getting
Not this week. In
okay.
the future, could be when childhood vaccines come out, those will be different.
But that's a
That's
booster.
an interesting question that you brought, because, at the governor's press conference on the 15th, one of the TV stations asked if the approved vaccine, Comirnaty, was the same as the vaccine that is currently being used under the emergency use authorization. Dr. Marsh asserted that it was the same, and he has no basis for that claim because the ingredients of each have not been released, the full ingredients. And I thought that that was a misstatement on his part, or at least, let's just say it's not based on any facts that I can find.
The vaccine that they asked for emergency authorization and approval, I understand it's the same vaccine. It's the same company producing. I have no information to suggest it isn't.
Well, I have no information to assume that it is. The ingredients have not been, and the liability profile on each one is completely and totally different. I mean, there are liabilities that the manufacturer has to, be under, operate under, which the emergency use completely, exonerates them from. So it's, from my understanding, what I've researched is that it's not the same vaccine.
It should be the same, right? Let's just say an unvaccinated person coming today and you're gonna give them a series of 3, you're gonna use that same vaccine to administer to them, right?
And
3
it's
shots.
the same vaccine that the state has already had a stockpile of. It's not any different.
It should be the same.
Show me some evidence of that. I'd be happy to change my.
Maybe you'll have to ask the company that. I don't have that for any product that I buy.
Yeah, but what you're saying is that they are the same, and on what basis do you make that claim?
From the company.
Well, when we're administering, we're getting from the same supplier.
I'm talking about Comirnaty and currently used vaccine. Are they exactly the same? Is that what you're saying?
There's no.
My
difference.
understanding and my expectation is that they are the same. I have no reason to doubt it.
But can you show me some proof that they're the same? So that I'm convinced?
We will have to go under the microscope as the Pfizer
I'm
company.
not
looks
sure.
under,
I'm not sure.
but they
what
promised
level
us
of
there is.
With the same, with any medication you get, I don't know what level of proof you need.
That
Dr.
they have
Reed,
the same.
what's the vaccination rate?
that-
How is that?
that they-
People continue to be vaccinated or not?
We're doing very few new vaccinations.
What percentage of the population
Just
is
like you
vaccinated?
go
It's
to,
still
you buy
about
over-the-counter
50%.
drugs, it's the same price.
about 50%.
If they,
About half of the
it's
population. We're seeing very few.
I'll
I'll show you a report that I think we gave. less than 100 doses.
Susan, why don't they just simply-
Do you have any other COVID stuff, or you think it's time for the health administrator?
You only gave 100 new shots last month, is that
Less
what?
than that. Sorry, shots.
I'm surprised.
All right.
They approved that.
Can we move on?
Okay.
Well, the proof I would need is a list of the ingredients and that they are in the same proportions, or a qualified analysis of the two of a source I could trust.
You'll have to seek that elsewhere. We are not the ones that have to recite.
I understand, but then if you're going to make a statement, you need to be able to back it up.
What we're saying is that we are giving the same dose that we have given previously.
That wasn't my question. My question is Comirnaty the same as the one that's being used now? Because Comirnaty is not going to be available for many months. That's my question.
So I will try and answer that for you as far as the labeling of it.
Thank you.
Okay.
100,000, 200,000 doses they have at the state stockpile.
Thank you.
Let's move on to agency activity report, health administrator report. Dr. Reedy.
So the COVID contact tracing, supplemental vaccines, which are decided on the individual medications. Calling for lab results that they haven't been able to receive. We are doing that. We've been trying to help results. Answer the right questions. That continues to be a significant amount, but it's not 100%. More and more. Talk to people who have reported. Report later. Things like headache or fairness, you know. vaccination. We've not given any. Haven't companies or businesses that in the past we have given them to are not having the employees get them because there's still a fair amount of remote working. So we're are able to. Companies that want to, any individuals that want to come for influenza vaccination, we have them here. It's powerful.
Should you separate them?
Excuse me.
You come out and say, hey, can I get my visor and my flu shot same day? Are you supposed to?
We can, since March, since May, we have not needed to separate. We can give multiple vaccines. We do this for adolescents who need their school shots and at the same time, and we influenza and COVID at the same time.
Can you combine them or just 2 shots?
They're 2 different vaccines. Whether the future has it that way, certainly a number of our vaccines are several different things together that will require. That's probably what will happen. I certainly would rather have one needle.
I'm not afraid of needle. I stab people too.
You did feel about this?
For a while, yeah.
Okay.
Mhm. I'm very good. I
Not
draw
bad.
monkeys.
Okay.
Seriously. Health officer report, so is that the same, Dr. Rishi?
The health administrator is me. so
Oh, sorry,
the
I
Dr.
have it
Rishi.
switched.
But, well, it's Gino now, but I don't think he's ready to give a report quite yet, since he just started on Monday. But, what I've been working on this past month is getting him hired, getting an office assistant hired, working with the Department of Personnel on this proposal, working on some of these grants, so that is trying to get approvals for those. Yeah. That's been the majority of my time.
Want to thank you for stepping into that role, because I realize that must have been very difficult for you. So thank you.
I agree. Big kudos to you for all that you've done for us for the last year. Thank you, thank
She
you.
applied for the job, but then decided after she made her application, she really did.
Right.
And
We
they-
were ready for her to take over.
And they got it anyway.
Well, it almost killed her. Didn't kill her, but she.
I'm having so much trouble hearing you, Dr. Reedy. I'm sorry. I should probably sit next to you next time.
I do have a couple things to say real quick. I did sit in at the front desk for a few hours, answering phones, interacting with patients, and it's given me an idea long-term, with an eye towards something, a long-term goal. First of all, we have to move away, and everybody's reading, I spoke, talk about this. We have to move away from paper records.
Yes.
And we have to move to
Alright.
digital files everywhere I've ever worked. I've helped make the that transition. Two previous office I managed, we went from paper to digital. And
Yeah, I agree. Actually, I spoke to someone this morning that said they came in for a vaccine, quite a strange one. So just like they work after paperwork, and the process making took over an hour of paperwork. It needs to be streamlined.
yeah, so those are all things that I have an eye towards. So that's absolutely in my experience. So that's one of the things. Also, streamlining all of those types of things, making sure patients don't come in and are required to fill out form after form after form. That turns people off, that tends to drive them away from you into a place that they find a little bit more convenience to do those types of things. So we need to make sure that that's one of the first things I know.
Glad you brought that up. That was a 9 o'clock or 8 o'clock this morning phone call. I appreciate that.
One of the
Also easier on the nurses.
One of the problems with vaccinations is just like any medicine you buy, it's the insurance coverage. It's not such a big deal if it's $20 vaccine, it's a $200 or $300 vaccine. Insurance to cover it. Certain vaccines they will not. It's obvious why they don't.
Not FDA.
but others apparently choose not to do it. For example, that home vaccine for adults, although it's not recommended, the insurance companies just won't cover. Shingles vaccines, sometimes they just don't. Sometimes someone wait is trying to get insurance company approval. So we can just wait. It's frustrating.
What's the update on that tablet grant? Do we have?
We have already ordered everything, so as soon as we have all of our invoices, we'll fill that.
That's gonna eliminate the paperwork.
For some,
Yeah.
some, but that's not, those aren't tablets for patients assigned.
No, those tablets are actually for the sanitary.
Those are for the
So that
sanitary.
was an environmental grant.
Yes.
So those tablets are for sanitary, so.
Can
I
we
think
do
there is
similar
similar
thing?
board that where they actually have to sign some things, especially when there's
Yes.
patients. Every time I go, I've been to lots of doctor's offices and things lately, and every time I go to a new one, I'm filling out a ton of paperwork every time, so I have to sign a policy, but that could be done digitally.
Absolutely.
And just, there's all kinds of people that they require an actual signature on.
We don't need to get down.
Other difficulties with records is cost is the extraordinary expensive hospitals have.
Yes.
Also, our internet connection through the state system that comes back, it's very slow. Now we have the advent of that's our phone system. Is most of our function.
It pretty much is not functional, so
At
it's
certain
been about a
times.
month where we can hear the individual that's calling, but they cannot hear us. And it's our building and the state police building. The county is working on a fix. It's just taking way too long. They're saying by Tuesday, they're gonna have a temporary fix in place. And then they have a couple other permanent ones that they're working on. to fix.
Yeah,
It's that they
we've been
say
having
it's a
that same
Wi-Fi
trouble.
issue.
We've been having the same trouble, just randomly, you're talking to people, they
And
can't
it
hear
cuts
you,
out.
and I don't know what it is. I mean, it's, because we don't have phone lines, we've got, maybe you have something, this voice over IP thing.
Yes.
So I don't know whether it's an internet thing or what it is, but
Frontier.
I don't know. I think we have both.
They said something about getting the line from Comcast, so I don't know if that would
It's-
be in addition to.
Yeah, so I
Frontier.
know exactly what the issue is.
But it is Frontier as far as I know.
the county has Frontier, but then they have Comcast backup, if Frontier goes down.
No, so
so
the issue is Frontier has voice over IP, but they don't have enough bandwidth and the DSL works, so you have to have Comcast behind it to get enough bandwidth that you
But
don't have it
they're
right now.
saying
Is
they're
that
gonna
right?
add another Comcast line, but they
You don't have
know-
enough-
They don't have a time frame for that.
You don't have enough internet bandwidth.
Right.
So the more people you have on the phone, the more limited the bandwidth is, and that's your breakdown.
So that it's a huge issue for us. So some employees, like our office assistants that don't get paid for the phones, are having to use their cell phones to call people back because they can't hear us. So
Yeah, it's just like uploading this video right now. That affects the call quality because of it.
And my understanding is we use Frontier because it's cheaper. And because the county is a different situation. You've got the multiple buildings. And if they wanted to use Comcast, they would charge us a separate fee for every building, whereas Frontier will charge the county one slightly bigger fee that supposedly covers all the buildings. But you have one building out here, so you could probably switch to what you want, and, wouldn't be
I
that
think
have
they're
that
trying
issue.
to do something for our building and the state police building because they've been having the same issues out here. So, and I did get an email, but the fixes are that they don't have a time frame on the actual fixes, and they're supposed to do something that is a temporary fix. Next.
If they need someone to climb.
Does the
tower
county
box,
pay the phone bill?
Right.
I don't.
Nobody can live
but I can tell you that.
I don't remember.
Because Marty talks about how much it costs for us to add phone lines, so there must be some expense to us. I don't know if it's an upfront expense or if we're paying something.
I don't remember ever signing a Frontier check when I was signing checks.
Yeah, I'm not
So
sure.
I don't know the answer.
So they might pay it, it is
The
a
county.
county service, so.
Well, the industrial park didn't have Comcast in it until 3 or
So maybe it's just the
That's the
actual
issue.
phone that we have to pay for when we just, I know Marty in the past, I remember talking about if we added another phone, there was.
That's the
move
voice over
on to-
IP, it's cheaper because you can have basically infinite lines, but then you run into the bandwidth issue. But I mean, it's kind of convenient that we used to have separate phone lines for the, like the faxes and all those kind of things, and then it would be presented some problems if you know, moved around or whatnot. I mean, if the voice over IP is kind of neat. I switched offices. All I did was unplug my phone, move 4 buildings away, plug it in, and while my phone's called. So I mean, it's handy for that, but it's also, I think you get the bandwidth issue and it sort of sneaks up on you because you don't know, you know, certain times of day, people might be calling more and all of a sudden, boom, you can't, you know.
And
you
we've
lose it.
had issues on and off for a long time, like they've replaced my phone line a couple times because they're trying to figure out what the issue was with my phone, because I've had an issue on my phone like that where I cut out or they cut out, I can't hear them. Often in the past, so it's a continuous problem, so I'm hoping that they have a permanent fix soon.
It's almost every call.
It seems like at certain times of day for us, you know, you just, like first thing in the morning's bad. And like right after lunch is really good, because I think there's a lot, you just, the volume maybe, you know, I don't, but it is distracting because I can hear you and you can't hear me. And it's sort of like a broken up cell phone call. Can you hear me? Can you hear me? And it's, you know, and it's random. So,
Let's move to the environment activity report. So actually.
So, these are the numbers for September. It's still a lot more subject than it is food. Still trying to decide whether or not to hire another sanitarian. Don't have the grant finalized yet, so we don't want to do that until it is. If we got another sanitarian, we'd be able to get more inspections done, and I think now that I am back to just being an environmental health manager, that should help them too.
What is the status of the newest employee in their training?
They postponed some of the training, so she's not gonna have her training completed. They were actually supposed to come in September to give with the state's, on the job training from the district sanitarian. But that got postponed because of the elevated numbers, so they can pull out traveling. So I'm not quite sure when she's gonna be done now. It's still projected, I think, the first week of November is the last I saw. I don't think that, on the job training has been rescheduled until she has that, she can't do food inspections. But she's doing very well. The state's still having issues with the form they're using Blackboard, and I guess they're just having trouble onto it. So, and then the good news is that once they get it all worked out, I'm not sure how long it'll take, but the sanitarians won't have to wait for training. They'll just be able, they'll have it there for them, like when they start, they can work through it at their own pace, and they'll still have tests at the end, but they need all of this stuff online. So we won't have to wait for the once a year training anymore. That will be the plus if they continue to do it virtually like this.
On the numbers here for well permit applications and septic permit applications. The number issued is more than the number applied for.
And that is, yeah, so some of those are from the previous month that they issued for this month. So
Oh.
she does it based on the date that they issued it, not necessarily the date that they received it.
I think that's my fault.
There were a lot of
I'm certain of it.
So they were definitely, they issued a lot more than
I
they
like somebody
received
who
this
takes
month.
responsibility.
So,
Yeah, I inundated them with 50 at one time, so they needed some time to get about to.
Okay. Well, good
They are
idea.
yours?
Huh?
They are
They
yours?
have
Yeah.
50 from last month that got rolled over to this month's conversation, because it takes a while to drive. They have to hand draw the permits, so.
So their applications in transit.
Yes.
Okay.
Handhelds that you're talking about. will improve that process.
Well, that's not gonna be for the septic, it's really not gonna have anything to do with the septic application at this point. We're back for food, so we can just do our inspection on the tablet instead of having the paperwork that somebody signs. They'll be able to sign it on the tablet, and we can email it to them while we're there. So we have to get all the programs installed on that. So Michael's gonna- We had to order the state approved brand, which is Dell, so they're Dell tablets. That's exciting, though. We're excited to have that and not have to, do the paper and give them the copy and come back here and enter the inspection. Yeah.
Will they be able to print it on site?
We don't have printers. I think what we're trying to do is be able to email it to and if they wanted a hard copy, we could always provide them. But we're not gonna have printers in the field for this.
I see there's food complaint here, it's like people calling to complain about restaurants and such. Do you go out and inspect them right away, or how do you?
We
do it?
try to do, it depends on what the complaint is, but if it's a foodborne illness complaint, that's supposed to be started within 24 hours. And it started means you have to call the person and we have to get a 7-12 history from before they became ill. And, but they're not all foodborne illness complaints, a lot are other complaints, like sobbing or whatever it might be. So, but we try to do that in a pretty good time frame.
We can move on to medical activity reports.
So there's another paper clinical services.
Please speak.
There's another paper clinical services report.
Thank you.
I've had these for several months. So the patient visits, let's see here. So what happens with each visit, so such sexually transmitted infections or family planning, that doesn't tell us what service they could be getting checked, they could be getting treated. So all of these numbers, our goal is to increase the numbers of them. Marketing is going to be big things we looked at with Gino as you go to. That's going to be very important. Marketing services. Walgreens sometimes we can get it here. We need to be more accommodating. That's the second Thursday. Epidemiology is, these are some of the foreign illnesses that get reported directly. Someone calls and says, I in such and such a place. And after they said it's this one. Those, mostly we get these from the state laboratory. When they find it positive, it's reported electronically to the state laboratory, and then they send it to us to investigate. A number of these are foodborne illnesses. One that's not on here, but would have been on here a month ago, is Lyme disease. Data on that, because we pretty much haven't done anything about it for years. We've known for 15 years that this is an area with lots of Lyme. Other parts of the state it wasn't, but now it's pretty much in the county. It's graduating. But simply calling up and being sure that they meet the criteria we call line. We don't influence treatment at all. It's just surveillance of, is there line here? So yep, there's line here. So the state now has agreed after pestering to require local health departments to use our limited staff simply to do a data reporting. Hopefully they will continue to do it because it's been at least half of our reports. The other that doesn't show here, that's a reportable disease that comes to us from the state, is the animal bites. That's handled. That's another large portion of the ecology.
Animal bites.
Animal bites
Okay.
are reported to the animal control and to the health department. And we then, our staff gives advice on what you need to do if you need. Is this a risk that you could get rabies? And if so, advise.
Do we work with animal control on that?
Very closely.
Oh, good.
So, and then if the specimen with the head of the animal is thought to be rabid, needs to be tested, then the head is very responsible for sending it to the state lab. Rabies lately,
Yeah, we had a positive bat and we put out an alert for that in that area that was found.
Bat.
Bat. And bats are there, a lot of bats have rabies, and oftentimes if you find a bat in your house, you have no idea if it's bitten you, you can't tell if you have a bat.
Or it's been your pet.
Right, so yeah, so the education that we want to get out to the public is that they should have all of their pets vaccinated. So it prevents, we're dealing with some 6-month double pet situations with 2 dogs that were exposed to a groundhog that we can't test. So they were not vaccinated, so they have to be in a 6-month double pet, which means they can't have contact with anybody in that 6 months. And if they were vaccinated, that would have been.
All right, we're gonna move on to review August 21 financial report. We
That was
did
moved to
We
the,
did.
that was moved to the top.
We
That's
need
what,
to,
that's what they,
we need to approve it.
Well, typically you do,
I thought we deferred, aren't we deferring that until?
yeah, I don't think it was quite finalized. They provided the July to September. They said the August numbers were finalized, but the September numbers are not. So it's up to you if you want to do that again. Didn't approve last month because there's questions on that August budget, which they didn't really address those specific questions that were on. the
Because
August
they were
budget.
brand new then, right?
Yes.
Okay, so
Do you guys want to move it
I'd
again
like
to
to make
next
a
month?
motion to move that to the next meeting, November 12th, this is.
Second.
All in favor?
Aye.
So we move it to next month. All the items on the agenda is finished. Do we have a motion to adjourn the meeting?
I move we adjourn.
Second.
All in favor?
Aye.
Motion approved.
Friday.
Thank you.
Happy weekend.
You too.
You go to the next house.
They are.
Yeah, yeah, I'd like to, I'd like to have that.
Yeah,
covered
so
up.
that's a development
It
project.
should be, MPA is very.
Uh,